Hi, my name is Courtney Holmes, and today I'm going to be presenting on Tanzania, which is a low-income country located in southern Africa. First, I'm going to show you a video that just kind of highlights what Tanzania looks like, because a lot of people have a misconception of what Africa looks like. They think it's just all run down and everything, and that's not really the case. So here's a little short aerial view of Tanzania. So as you can see, not all of Africa is like this rundown place. It's actually really pretty. So we're in Africa, like I said, it's right here kind of in the southern part of Africa. It borders with Uganda, Kenya, and a few other places we'll see another map later. So who exactly are these people in Tanzania? As of 2010, there was 44.8 million people, and that's a big increase because in 1967 there was only 12.3 million. So the population has really increased in the last few generations. As you can see, the next statistic says that people aged 15 and younger make up 44% of the population, which is an astounding amount, and people 65 and plus only make up 4% of the population. As for the work they do, 70% is rural living and agricultural work, and 30% is more urban and just other mixture of jobs. The life expectancy for females is 54 and males is 51, which is way lower than here in the US. Here's just like a chart of males and females and the ages. As you can see, the younger group's ages have way more people in that age group, and it just declines as it gets older. So what exactly is HIV? That's what I'm going to be talking to you about today. HIV, this is from the CDC definition. It says HIV is a virus spread through certain body fluids that attacks the body's immune system, specifically the CD4 cells, often called T cells. Over time, HIV can destroy so many of these cells that the body can't fight off infections and disease. These special cells help the immune system fight off infections. Untreated, HIV reduces the number of CD4 cells in the body. This damage to the immune system makes it harder and harder for the body to fight off infections and some other diseases. So there are some stages of HIV. So first, a person will develop flu-like symptoms for 4 to 6 weeks, and this will happen within 2 to 4 weeks of getting the virus. And then all of a sudden they feel better, and this is called the HIV inactivity stage. This can last for months or decades, it just kind of depends on the person. And then all of a sudden it gets really bad, and they develop AIDS, full-blown AIDS, and this is when the immune system is too weak to continue defending itself. So HIV in Tanzania specifically, the first case was in 1983 near the Uganda border, which is right up here in this red line. It rapidly spread since then. Large productive parts of society were affected, so that's why we have more like rural work now. And it left many orphans because it affected a lot of the older population. So how's it spread? A lot of people think like gay people spread it and whatnot, but actually 80% of it is spread through heterosexual transmission, through unprotected sexual intercourse with an infected partner. Mother to child, this is called vertical transmission. It can happen in utero during delivery or from breast milk. And this happens 5 to 15% of the time. And the last way it can be spread is through the contamination of blood. That's just the remaining percentage. So as far as the prevention and treatment, health professionals in Tanzania began to develop some ideas. General population lagged behind, but in 1988 several organizations launched, and in 2004 there are now a lot. And it acquired many resource partners, which was awesome for the decline of HIV in Tanzania. From 2003 to 2007, in the group of people aged 19 to 45, the rate of AIDS went from 7% to 5.7%. Pregnant women went from 7.4% to 6.8%. And in urban areas, we saw a really big decrease from 24.2% to 13.3%. And this was because, like we said, the scientists were in the urban areas discovering like what was going to make HIV go away potentially. And so the urban areas most affected. And then it continued in 2007 to 2012. One age group, 19 to 45 again, went from 5.7% to 3.4%. Next, we're going to talk about co-infection of HIV and tuberculosis. So TB is very common for HIV patients because, like we talked about, HIV patients have a weakened immune system. TB is a very aggressive illness, so it attacks an HIV patient and they have no way to fight it off. Increase in TB highly associated with the spread of HIV. And in 2005, 51% of TB patients were HIV positive. So what exactly is tuberculosis? Another wordy medical definition, but here we go. TB is a disease caused by a bacterium called Mycobacterium tuberculosis. The bacteria usually attack the lungs, but TB bacteria can attack any part of the body, such as the kidney, spine, and brain. If not treated properly, TB disease can be fatal. That's from the Center for Disease Control and Prevention again. So it's kind of just an illustration of what TB does to the lungs. So this is just a map kind of showing Tanzania is here. You can see it's one of the most affected countries in all of the world, having 300 to 499 million cases per year. TB in Tanzania. So the main rise occurred in the 1990s, and this makes sense because if you'll remember, HIV started in 1983. So by the time that kind of caught on and TB became a bigger deal. Whereas WHO estimates that Tanzania has the 14th highest TB burden in the world. So that's saying something. I'm the 14th highest in the world out of all the countries there are. And Tanzania is not very big, so that's a lot. In 2006, it was actually named a national public health emergency because there was 26,000 deaths. So, an attempt to fix things. More than 1,000 private and public facilities now have TB and HIV services. The improvement of diagnostic equipment, there's better training of health professionals, and there's better education of the general public. And they're also working with neighboring countries to prevent transmission. So that is my presentation. This is my works cited, and thank you very much.